Wash hands. Obtain all supplies needed. Supplies that is not in the resident's room or bathroom. Knock before entering the room. Identify self by name, identifies resident, and greets resident by name.
Good morning, Ms. Torsha. My name is Val. I'm going to be your CNA today.
Disinfect bedside table and put a barrier down. Put down appropriate supplies on surface.
No supplies are needed for the skill besides a gait belt and a wheelchair.
Wash
and
his hands.
non-skid shoes.
Wash his hands. Checks resident's wristband. Explain procedure to residents. Speaks clearly, slowly, and directly. Maintains face-to-face contact whenever possible.
Today I'm going to be getting you up into the wheelchair. Is that okay?
Yes, it is.
Set up supplies and obtain other supplies needed. Supplies that is in the resident's room and or bathroom. Provide privacy for the resident with a curtain, screen, or a door. Locks bed wheels. Raises both side rails. Adjust bed to the lowest position so that the resident's feet are flat on the floor. Lower one side rail on the side of the bed that you are working on. Remove wheelchair's footrests close to the bed. Place wheelchair near head of bed, with arm of wheelchair almost touching the bed. Wheelchair is facing the foot of the bed. Place the wheelchair on the resident's stronger side.
So she has left-sided weakness, so I am placing it on her right side.
Lock wheelchair wheels. Locks bed wheels. Raises head of bed. If assistance is needed to sit on the side of the bed, assist resident to sit on the edge of the bed by placing one arm under the shoulders and one arm over and around the knees. Raise the upper body at the same time you move the legs off of the bed. Make sure resident's feet are flat on the floor.
Okay, on the count of 3, I'm going to move you to the side of the bed. 1, 2, 3. Okay, and you can just scooch forward for me until your feet touch the floor. And then I'm going to place a pillow behind your back just in case you feel dizzy or lightheaded.
Put on non-skid footwear on resident and securely fasten. Stand in front of resident. Stands with feet about shoulder width apart. Bend the knees and keep your back straight.
I also take my heels and I put my heels together so the resident, when I'm getting them up, they're not going to slide in between my legs. So as you can see, my heels are closer together, the front of my feet are spread apart, and I'm knee to knee.
Place gait belts around resident's waist, below the rib cage and above the waist, over clothing, never on bare skin. Check to make sure that skin folds are not caught under the belt. Grasp belt securely on both sides with the hands in an upward motion.
Okay, Ms. Torsha, I'm just making sure that the belt fits securely and that I can fit 3 fingers underneath the belt.
Brace residents' lower legs with caregiver's legs to prevent slipping. Tell resident on the count of 3 to use hands, if able, to press into the mattress to straighten their elbows and knees to come to a standing position. On the count of 3, Slowly help the resident to stand while still grasping the gait belt.
Okay, 1, 2, 3.
Tell resident to take small steps in the direction of the chair while turning her back towards the chair.
Can you reach for the arm rest on the wheelchair?
Ask resident to put hands on wheelchair armrests, if able. When the resident's legs touch the back of the chair, help her lower herself into the chair. Reposition resident with hips touching the back of the wheelchair.
I just want to make sure that you're all the way back into your wheelchair.
Remove gait belt if used.
I'm just going to remove your gait belt.
Attach footrests and place resident's feet on footrests. Check the resident to make sure they are in good alignment. Little knobby things. Make resident comfortable. Put up side rail and return bed to lowest position. Follow resident's care plan about side rail usage.
So I'm going to take one side rail down.
Apply gloves and remove all supplies and barrier from the table and disinfect the table.
There was no supplies needed for this, so I didn't use the table.
Leave call light within reach.
Hey, Miss Torsia, this is your call light. If you need anything from me, just press the button right there. Thank you.
If resident is still allowed to stay in their room, please make sure that their wheelchair is not locked,
Okay.
as that can be a restraint.
Unlock your wheelchair so you're free to move around in your room.
Is courteous and respectful at all times. Report any changes in resident to the nurse and document procedure using facility guidelines.